Good afternoon, everyone. I'm here to speak about type 2 diabetes. According to the Center for Disease Control and Prevention, 40% of Americans are living with either type 2 diabetes or prediabetes. And when this is left untreated, type 2 diabetes can cascade into numerous worse conditions such as blindness, limb amputation, or kidney failure. And while supplements and a lifestyle change can be implemented to help reverse diabetes, there is no known cure from a molecular standpoint. This is pretty significant because all of our conditions stem from a molecular basis. If there's a deficiency or an abnormality in a protein in our body, that's what creates the disease in the first place. In the case of type 2 diabetes, there's a problem with insulin secretion. Insulin is what your pancreas secretes to lower your blood sugar levels. When you eat a lot of sugar or just carbs in general, that causes your blood sugar level to increase, and this increase is what the pancreas detects in order to secrete the insulin and then bring those levels back down to regular levels. There are a lot of proteins that help with this whole process of insulin secretion, but I'm going to focus on one specific protein called granulin. Granulin is one of the final proteins. What it does is it binds to the cell membrane of a pancreas cell, and it helps bring the insulin that's made in the pancreas cell, and it helps secrete it out of the pancreas cell. It's a complicated process, so I won't go too much into details, but just know that by binding to the cell membrane, then it can help release that insulin. And it's been known in prior research, according to Dr. Jefferson Knight of the University of Colorado, Denver, that when more granulin is bound to the cell membrane, it actually decreases insulin secretion. So just know that more granulin means less insulin. And this is pretty significant because in type 2 diabetes, not enough insulin is being secreted. When in normal people, like I mentioned before, when they intake sugar and their blood sugar levels rise, the pancreas secretes insulin and then insulin brings it back down. But in type 2 diabetes, those levels stay high. There's not enough insulin being secreted, so they're still high. And that high level of blood sugar is what can lead to worsened conditions later on. And knowing this and knowing what granulin does, granulin can help serve as some sort of molecular treatment for type 2 diabetes. Because people with type 2 diabetes need more insulin secretion, that means that they need less granulin bound to their membrane. And that's what my research specifically focuses on. What we are doing is finding the points of granulin where it doesn't bind to the cell membrane. So each protein is made up of all these individual amino acids, and when you change or mutate even one of those amino acid residues, you can completely stop its function. In this case, its function is binding. So when we've been focusing on mutating specific points and specific amino acids, and we're recording if it still binds to a cell membrane. If it does, then we don't worry about that mutation. If it doesn't bind, then we focus on that mutation and we basically implement those mutations into live cells, and we test how much insulin is being secreted. And the research that has been done previously does back this up, and we found that when these points that block that blocks the granulin from binding to the membrane, when those points are mutated, granulin doesn't bind to the cell membrane. And then we later on find that when we use those specific granulins, then more insulin is secreted. So basically what this entails is that this is a possible theory of some sort of molecular cure to type 2 diabetes. This isn't set in stone, and we're not working with human cells yet, but we are still working on our way there. And taking all of and I've talked about a lot of concepts, and it may be a little overwhelming to keep track of everything, so allow me to reiterate and go back to the bigger implications of my research. So taking all of the information and theories, we can connect them together step by step. Inhibiting the protein granulin that's in your pancreas can increase the amount of insulin secreted from your liver. And in type 2 diabetes, not enough insulin secretion is happening, so inhibiting the granulin in a patient's pancreas can offset their deficiency, and enough insulin can be secreted to lower their blood sugar levels. Thank you for listening to my talk.